Today, I'm excited to be joined by Elizabeth N. Legg, MOTOTRL, an expert in the area of sensory based pediatric feeding. We'll be diving deeper into this topic, including recent research and actionable takeaways you can implement right away. Welcome to Pediatric Pioneers, a MedBridge podcast where we conquer challenging topics for the pediatric therapist through conversations with pioneers who have blazed new trails in our practice. Our aim is to deliver actionable takeaways for practitioners like you. To receive continuing education credit for this episode and access bonus resources, make sure you check out medbridge.com. Hello, I'm your host, Nicole Quint, and I'm an occupational therapist with over 20 years of experience in practice and academia, specializing in pediatric practice and the improvement of occupational participation and performance through my expertise on executive function, visual perception, social emotional learning, sleep, and sensory processing. It is my passion to support pediatric therapists like you so that you can best serve the families under your care with evidence-based practice solutions, easy to implement advocacy approaches, and new ways to lean into your skills within the challenging pediatric landscape. Welcome, Liz.
Hi, Nicole.
I'm really glad that you could join us today. Could you get started by sharing a little bit more about yourself and how you grew your expertise in sensory-based pediatric feeding?
Sure. So I have been an occupational therapist for about 15 years, solely in pediatrics. I own a pediatric private practice in Ohio, so Kidz Connect Therapy. We do OT and feeding therapy. I'm trained in SOS feeding as well as infant feeding. So our clinic is very family centered. We support children and their families with a variety of developmental issues. So a lot of our caseload is autism, sensory processing disorder, is the majority of our caseload. So feeding has always been one of my biggest passions. So I've worked with infants with complex medical needs, toddlers who are very selective. I've had a lot of older kids, school age kids, mostly navigating sensory based feeding difficulties, but some oral motor stuff as well. And I do have some infant feeding training also, but mostly that school age toddler age as well. So a little bit older kids is kind of my specialty and using that SOS approach to feeding. I also run an online support group for parents working through picky eating, and my goal is always to bring practical, evidence based strategies to the table. So, both figuratively and literally.
I love that. So you've been trained in the SOS feeding approach by the great Kay Toomey. And can you explain to everybody, because we might have some people that aren't familiar with SOS feeding, what that stands for?
Yeah, so it's sequential oral sensory approach to feeding. So Kay is actually a psychologist, so there's a lot of psych background with SOS, which I love. So it's definitely a big piece, and it's all about that. This the sequential approach. So we look at what step they're at in feeding, and how do we get them there in a way that's not pressured. So that's a lot of what I teach families is not to force them to eat different things when you're looking at a picky eater, but really how can we encourage them and give them control in what they're wanting to eat or what they're willing to try, and how do we work up those, we call them the steps to eating, and how do we work up those steps in a way that is trauma informed, that's not going to be traumatic for that child and that family.
Yeah, that's really an important piece of this. I'm really glad you talked about how it's sequential, it's developmental, but
Yeah.
there's this psychological background because if we kind of think about how some things have been done, there used to be you're going to bed without dinner, there's punishment, there's
Yeah.
shame. It gets
Yeah.
complicated around feeding. And then when we think about the occupation of it, it starts to have all these layers of the social. Um,
Yeah.
there's so
So,
many things involved.
feeding is such an
Holidays.
emotional and foundational part of childhood family life. Eating and reproduction are the only two things that we do as human beings that take all eight of our senses. So, if it's not going well, it can impact everything: nutrition, growth, family dynamics, mental health. There's such a big piece, eating just being embedded into our daily lives. So, We participate in the occupations feeding and eating multiple times a day. It's one of, the only things outside of play that I feel like that we really do, multiple times a day. When we start our day, we a lot of times end our day around feeding. And there's a big social impact when it comes to feeding. So, children and adults, we want to be able to go out to eat with our friends. We want to go to a birthday party and be able to eat what our friends are eating. And I find that in my practice, that's when, I get middle school age kids because they want to be able to eat, what their friends are eating. They want to
Right.
be able to go to a birthday party or go, out to eat with their friends and at least have something that they are able to eat that's not, chicken nuggets and french fries, like to be able to try, something different and go to any restaurant that their friends want to go to. Um,
Right. Yeah, and that's such an interesting thing because we're talking about something that persists as they get older and it has all these kind of layers of anxiety and emotion like you were saying. So, are there any kind of we're kind of talking here about why it's important to discuss this topic of sensory-based feeding. Are there some questions that we should be asking or
yeah.
anything that we
So
should be questioning on this topic?
I think, as OT practitioners or other clinicians that are working with feeding, we need to shift away from simply labeling that child as picky and instead, what's going on underneath this? Is there a sensory related component? Is there something going on oral motor wise? Is it medical? That's one of my first questions that I asked is there something medical going on here, especially if we're having all of a sudden a picky eating issue? Kids either learn to eat or they learn how not to eat. That's what Kay says is they either learn how or they learn how not to. And so we have to really figure out, how is this child experiencing food? What do the caregivers need to do to feel empowered and supported when it comes to feeding?
Mhm. Yeah, and you were talking earlier about how can we also empower the caregivers as well, and I think, that's why this is such an important topic because there's a family component, there's the kid or maybe the middle schooler that we're working with. Um, and earlier you said something it was really interesting how you said that there's only feeding is one of only 2 things that use all of our 8 senses, right? And so
Yes.
what are those 8 senses? Because I
So
think
we have
it's
the ones
important.
we know, auditory, visual, gustatory, olfactory, tactile, and then we also have vestibular, proprioception, and interoception. So just, as a reminder, those are our 8, and feeding takes every one of those. And again, it's one of the only 2 things that we do as human beings that take all 8 of those senses. So, we think sometimes it's just like sit down at the table and eat, and it's really not that simple. It's we have our body has priorities, and number one is breathing. So if our kids aren't breathing well, feeding's not going to happen well. And two is posture. So if they're not able to sit up well posturally, that's one of the first things that I look at when I go into a home or I have a kid in my clinic or when I'm talking to a parent is what does their posture look like? When you go to a you're sitting at a bar at a restaurant and your feet are dangling, like how
Mhm.
that feels for you. So making
Right.
sure that our kids have that good postural support. And a lot of the kids we work with have lower tone, so they're going to have some postural issues. And a lot of times when we fix that, we see such a big improvement in what they're able to do at the table.
There's such like we were talking about the social component, but if you're trying to just focus on managing your food so that you can swallow safely or you can chew it up, it's gonna be hard for you to concentrate on hanging out with your friends or, now we're adding all these layers of safety involved. So, you know, it has a lot of layers to it.
Yeah, for sure.
Yeah. So, I'm glad we talked about the 8, senses. I know back in the day, I remember we used to say there were 5, then there was 7, now we know there's 8.
Yeah.
Um, and so, we also know that there's all these different types of feeding. Like you said, there's the oral motor part. We're kind of focusing on the sensory piece today. So, what does the recent research say about sensory based feeding? And can you give us some of the highlights of the most important takeaways?
Yeah.
And then, first of all, I'm going to kind of prompt you by saying, can we start by defining eating? And I'm glad that you said we don't necessarily want to label these kids as picky eaters, but we do have a definition.
Yeah. So SOS looks at if they eat 30 or less foods, that would be a picky eater in that area. problem feeder is your 20 or less. So I really, when I do an evaluation, I really look at, okay, am I looking at a problem feeder? Am I looking at picky eater? And there's a lot more things that come into that. Are they eating at least a couple proteins, a few fruits and vegetables? Are they eating starches? Are they only eating one color of food? Are they not touching, any fruits and vegetables at all? So what does that nutritional intake look like as well versus just, the number of foods that they're eating? Are they only eating snack cakes? Is there no protein in their diet, at all whatsoever? But really for me, I think it's how does it impact them, in terms of their occupations, right? I think that's the biggest piece is, looking at what's going on underlying and then how is it impacting their everyday life. So, if a kid is their weight is good, that's something that we have to look at as well. What are they eating, or are they not eating any protein at all, and how can we get them just a little bit of protein, or those kinds of things.
So there's that quality and quantity. So the
Yeah.
definition is more of a quantity, but then we also need to look at the quality of the food as well.
Yes. Yes.
Okay, that makes sense. So what does the research say about, I guess, where does it start?
Yeah.
Kind of how do we
So,
understand this
re-
picky and problem feeding
yeah.
that comes about in some of these kids?
Recent research emphasizes the importance of early intervention. The role of sensory processing differences is huge when you look at feeding challenges. And then the effectiveness of that multidisciplinary play based approach like SOS. So I think that play based approach is important. We want kids to have fun at the table. We want them to want to be at the table. When we increase that adrenaline, their appetite goes down. So I think that's a really important point. We have to be really careful, not to get their adrenaline up and then we just kick their appetite down. So I think that's a big, huge factor when you're thinking about as a parent, and we're like, you need to eat, you have to eat this before you get any dessert. Well, you just killed their appetite. If you've got their adrenaline, adrenaline's gone up and that appetite is down. So that's one big piece. I think thinking about early intervention. So there's been some studies that picky eating behaviors often begin by age 2. They can persist into later adulthood if not addressed. So in 2021, there was a study, a expert panel endorsed responsive feeding during the first 1,000 days, so conception through that 24 months of age, as foundational to develop healthy eating behaviors and food acceptance. I have a friend, and I asked if I could share her story. So I worked with her older son, and he's a very picky eater. So he's about 8 years old now, extremely picky eater. He went through food therapy. He added a few things, but he's still a very picky eater. So they have a baby now. And one big thing that had talked to her about when she was having the baby, she's like, I'm going to let him eat everything. I want to expose him to everything, just letting him play with food. And he does. He eats anything and everything. So they go out to eat. He will try everything. She's like, it's just the exposure because his dad's a very picky eater. And so I think their
Oh.
older son didn't have a lot of exposure to different kinds of foods. And so this baby eats everything. He's been exposed to every kind of food. So he eats anything and everything. So I think just that early exposure and that early intervention is very important.
Yeah, so that
When
first
you
2 years is key. That's very
Yes.
interesting.
Yeah. Yeah. So, that seeing kids in early intervention is really important. And I love the early intervention model for feeding because it's a parent coaching model. At least it is in my state. We have a very parent coaching model. And I loved it even when we were able to we were doing a lot of visits virtually. And that worked really well because it almost had, the parent had to, um, you know, I coached, but the parent had to be the one that was presenting the foods and doing everything like that. So that was a really great model. I feel like in that early intervention and really just starting at that young age. I think when you look at the sensory piece of the research, so taste and smell sensitivity has been found to be significantly associated with limited food variety and texture difficulties. Parents describe texture, taste, smell sensitivities as central to picky eating behaviors. So I feel like those three areas, definitely. But again, it's all eight. All eight of our
Mhm.
our senses are involved when you look at sensory piece. And when you look at kids that have autism, it can take up to 70 times of being presented with a new food before they can even say that they like it or not. So, when my kids come to food school, which is what we call it, my kids that aren't autistic even, they're not allowed to say they don't like it unless we've done it 10 times. So that at least 10 times, and
Wow.
then we can say that, okay, this is just something that I don't like. And that's okay. That's okay. But a lot of times, they know that 10 times rule. And that's not even tasting 10 times, just being exposed to the food 10 times.
And the
That's
70 times, is the 70 times just
it's
exposure or is
autism.
that
Yeah,
tasting?
for autism, yeah, can be up to
Okay,
70 times. Yep. Yep.
interesting.
There was another review, evidence linking sensory sensitivities to restricted eating behaviors and neurodiverse populations specifically. So, I mean, there's a lot of research related, sensory based feeding difficulties for sure.
Mhm. And I'm gonna tell you right now, I've hit my 70 times or my 10 times with broccoli, and I'm sticking with it. I don't like broccoli.
Right. I know. But, I think it's funny, and I always tell my families this, like, I did not like seafood until I was in my 30s. So our taste buds change too,
They do.
right? Like,
Right.
and watermelon, like, I love the smell of watermelon. I like to look at watermelon. I always think it looks so good. I try it almost every time, and I do not like it. I cannot eat watermelon. Now, I'll
It's
eat
my
it in
favorite
food
thing.
school with my kids, but I'm like, okay, I'll try this with you. Mustard is another one that I'm like, I've tried this a lot of times, but I'll still do it at food school. We still try, but
Right, and I
I'm
think,
like,
you
okay, I'll
bring
try
up a
this
good
with you.
point. There we all have things we don't like,
Yeah,
and I
yeah,
think this is that fine line of when is it a problem, and I hate to say it's a
yes.
problem, but when does it need some kind of intervention?
Yeah. Yeah, and I think that that's a great point. Is it causing stress within the family unit, right? So, and,
Right.
and what occupations is it causing difficulty in? Is this a child, a middle school age kid like we talked about, that's like so bummed socially because they can't go out to eat with their friends? It's really causing issues in that area. Nutritionally, are we at really low weight from a nutritional standpoint? Are we having trouble, like we can't eat anything that's not in a package? So what are kind of those implications? And I think as occupational therapists, we're really good about analyzing that. What areas of occupation is this really impacting? And is it really an issue? I think it's really difficult too, because we're moving into being neuroaffirming and making sure that we're still neuroaffirming. And that's why I bring up the point about, like, I have this middle school age kid, but he wants to be involved, and he wants to be able to eat new food so that he can do these things with his friends. And I have that come up all the time. Now, if I had a 14-year-old that was like, I eat 5 foods and this is just the way that I am and I'm fine this way, we're not going to make much change there. So, I
Right.
think that brings up a really good point of early intervention as well, when
Right. But I
you're
think
thinking
but
about that.
you're also bringing up the point too that temporal context matters. And when you
Yes.
have an older middle schooler or something that says, "I do want to change," that
Yes.
we kind of address that and say that
Yeah.
it's not too late. And I love that you
Yeah.
brought that up because
Yes.
I have a love for middle schoolers. They're often
Yes.
forgotten about.
I love my middle school kids, and they're so good. They can do the food science, like, they can make new recipes, and they can understand,
Fun.
hey, if you change this in a recipe, what happens? They can really use that food science approach, which I love. So that's one of my favorite ages to work with, is that middle school age. I love working with those
Yeah,
kiddos.
they would be really fun. So,
Yes.
we talked a little bit about kind of the origins, which I thought was pretty interesting, the relationship with the neurodiverse population. So, what does the research say about interventions?
Yeah. So feeding interventions that are child led, I think, is really important. That respectful being sensory informed, leads definitely leads to better outcomes. So not just in food acceptance, but in reducing that family stress. There's a lot of research there. So Kim et al. In 2021 compared an SOS style intervention approach, so child led graded exposure, that sensory play, to a standard nutrition education, and children in that sensory intervention group demonstrated significant improvement in mealtime behavior. Whereas the control group showed no statistical change. So I think that is a really important study, that
Yeah, it
talks
sounds
about,
like it's a randomized controlled trial.
yes.
Wow. Okay.
And then there was a feasibility study specific to the SOS approach. That was just out in 2025, actually. So this study introduced behavioral coding aligned with the SOS steps to eating hierarchy. This was from Shona et al., actually. So Sarah, shout out to Sarah. Highlights sensory informed, child led relationship based intervention, and the sensitivity of the fidelity measure showed measurable change in both child engagement and caregiver stress, illustrating its impact beyond mere food acceptance. So I think that's a really important study, too.
Yeah, and we will give Sarah a shout out. She was
Yeah.
on Pediatric Pioneers, I think episode 3 or 4, so we'll definitely give her a shout out so anyone can go back and listen to her episode because I know that she has worked with Kay Toomey before, and I think, these recent, research articles are um, really affirming that this SOS approach is an effective tool that we can use with
Yeah.
kids.
And SOS isn't the only one that's,
Right.
child led, but that's just what, my training is. And so I
Mhm.
think as long as you're just remembering that, you know, eh, eh, that point about when you get their adrenaline up, their appetite is down. I think that's one of the biggest points is just remembering that we want to keep it play based, child friendly, sensory informed. Did we go too far? Do we need to back down a little bit with this food that we presented? And being able to have that clinical reasoning to know, like, oh, this kid's trying to escape the table. Let's back up. Let's go back to something, that they were doing well with. And, let's try to work back up and just not, that no pressure approach is going to work better.
Yeah, and success focused and
Yeah.
observation focused, which OTs are great at that. So it's
Yeah.
leaning into our strengths, but also that success focus. I love that piece of it because so much of this is about control. As somebody
Yes.
who has some food restrictions, having that control
Yeah.
over the taste and smell
Yeah.
and the
Yeah.
texture, um,
Yeah.
pushing people is going to just, like you said, create that adrenaline that we're trying to avoid. hmm
Yes.
So, there's this, you know, growing awareness that picky eating is on a spectrum. And we talked a little bit about that quantity, quality. There's a lot of layers to appreciating the nutrition, the restrictions. There's this developmental piece to the puzzle. Um, y- One of the things you talked about earlier is that coaching the parents, and you talked about this, when you were doing it online through telehealth, is key in this type of treatment. So, could you
Yeah.
share a little bit about what the research says about
Yeah.
that?
So there's a few articles that I pulled specifically, but there was I can't say this name, Blennerhaus et al. In 2023. They did a systematic review that focused on caregiver-led feeding interventions. It was specifically with autistic children with food selective issues, and all reviewed studies reported improved food outcomes. Through caregiver involvement. So, through coaching and implementation, shown to support positive feeding behaviors and family engagement. Then there was another pilot case series from Moldalker et al. So, empowering caregivers through coaching strategies. Significantly improved mealtime dynamics and child cooperation. And this was called the Engaged Eaters Program Early Development Pilot Case Series, is what this one was called. And the emphasis was on practical parent coaching as a driver of change. So, really coaching parents. And in my program that I do online, I don't even meet the child. So I just talk to the parents and give them practical strategies that they can use. They may tell me a little bit about their kid, but I don't need to know the kid. I give them the tools to, evaluate what might be happening, and then how just some strategies that they can do to meet their kid where they're at. So a lot of the things that we've talked about, just take that low stress, playing with food, working up those steps to eating, how they can do those kinds of things at home, and be that coach for their kids. So there was another study in 2024, Holland et al., and this was a qualitative study. It was done in Australia, and it looked at occupational therapist clinical reasoning when supporting picky eating, and caregiver coaching, and recognizing the continuum of picky eating from mild inconsistency to more entrenched patterns was reported as central in treatment approach and decision making. So again, talking about that caregiver coaching piece, I think is really big. And I think so many parents are, especially if their parents were like, my parents were, you're going to eat this or you're not getting any dessert before you go to bed. For some kids, dessert is the easy thing to eat, right? Like if they have an oral
Yeah.
motor or a sensory issue, packaged fudge round is an easy food for them to eat. So, I think thinking about like, okay, they're wanting dessert, but what are the qualities of that dessert that they're wanting? And how do you coach a parent in figuring out like, oh, my kid is only eating these packaged foods that are the same every time I pull them out, right? So, kind of encouraging them to be that detective themselves of what could be going on here.
That predictability, right, of the
Yes.
packaged
Yes.
food. That's
Yeah.
interesting.
Yeah.
So that's a lot of research, right? We
Yeah.
know that there's this 0 to 2 origin story, right? We so early intervention is important. We know that there's the child-led piece of it, there's a sensory piece of it that's effective. We know if we add play in there, that can be really helpful, and that we give that exposure, right? You said 10 times to 70, depending on the population. And then we know there's a parent coaching piece of this.
Yes.
So all of these are things that OTs we shine in, right? So I love that. So how do we translate all this amazing research into the clinic, into the hospital, into the home health or early intervention settings?
Yeah. So when you look at, certain patients or conditions, I think first, so like what's going to be most appropriate. So I feel like kids with sensory sensitivities, obviously, autism, anxiety, a history of negative feeding experience. So if they had some kind of trauma as a child, those kids that have learned how not to eat, those are the kiddos that we're looking at. So this might look like, in a clinic setting, that gradual exposure for a child to new food using play and curiosity under pressure. So, I have a kiddo that I worked with that we did a cheeseburger, I think, about 30 times. We did a cheeseburger every time he come, and the kid loves cheeseburgers now, and he'll eat a cheeseburger from anywhere. But that was a big thing for his mom. They were a family that ate cheeseburgers a lot at their house, so that was a big thing. So just that exposure, and we started with just the bun if that was something that he liked, and then we tried just the burger by itself, or he really liked cheese, so we added cheese, and we tried different kinds of cheese. So just adding those different ways, and how we can change that food. And again, now he can eat it from anywhere. So, looking at how do we change foods from what they're already eating right now, and how can we change that to what those goal foods are? So it's building trust. So starting where the child is, honoring their cues. Like I was talking about, noticing like this kid's moving away from the table. I just brought this out. They're moving away. So how do we got to go back. We're going to clear that off, and we're going to go to a food that was safe for them. And we might try that one again later in this session, or we may not, depending on what their reaction looked like. We might try that again the next time. And the research also tells us that parent involvement is very essential. So every session should include some form of caregiver coaching or modeling. I have older kids that maybe their parent doesn't stay, but I send home a list for them to do every week. And we set goals on there. I love to do that with my older kids. Like they may have a goal of, trying 3 new foods this week or something. And they set those goals. They pick them themselves, like what's going to be reasonable for them. So like 80% of their foods are of their meals are going to have a protein, a fruit and vegetable, and a starch. And they set that goal. Like what do they feel like is attainable for them? And they love meeting those goals. They love bringing their paper back and showing me, hey, I met all of these goals this week.
Yes, I love there's so many layers of the empowerment, not only with the
Yes.
parents, but with, older kids, and that's really cool, but even the younger kids. I mean, there's like a lot of confidence from overcoming some kind of fear or something that feels intimidating or, if you're moving away from it, that's a
Yes.
pretty heavy
Yes.
sign. There's
Yeah.
some stress there. So, and I love that, we talked a little bit about navigating that line of when to step in and focus on treatment. But you also talked a little bit about, this isn't just the cheeseburger. This is a cheeseburger at home, maybe at a party, the cheeseburger at a restaurant. There's a lot of different, factors
Yeah.
into that predictability. So that exposure piece is really big in that kind of scenario. So,
Yeah. And
we're
that kiddo didn't only add a cheeseburger. I think by the time he left feeding therapy, he had like 75 foods that he was eating. So,
oh,
we worked on
wow.
cheeseburger, but I think he was so empowered by being able to do, to eat this cheeseburger that was so scary to him at first. And then he added things like, well, if I can do the cheeseburger today, I can also do this other thing that, is orange like my cheese, right? So,
Mhm.
there was so much of that we see as well. Just, it wasn't just the cheeseburger. There were so many more foods that he was able to eat by the time he
Kind
left.
of the guard letting down the guard
Yeah.
to open
Yes.
up to some
Yeah.
other things. So, you've obviously had a tremendous amount of success working with these kids and families. And so, how do you see this playing into a therapy session? Let's kind of talk about from the exam and intervention approach. You were talking about these research elements, and how you just start the process with that evaluation.
Yeah. So my families do obviously an intake, and so I look at what's their current kind of food list. What are they currently eating? But also so much of it is their history. Is there something medical that happened? I
Mhm.
really want to look at like what's caused them not to want to eat, right? Like what's going on, that underlying stuff. So I look at sensory responses, oral motor skills. What's their mealtime environment look like?
Mhm.
That postural piece that we talked a lot about, and then also that caregiver and child interaction pattern. So what does it look like, when mom is sitting here at the table with this kiddo? So I usually have them bring like three things from home that they'll eat and something that mom wants them to eat. And like if they have a specific cup or a specific utensil or something that they use, we'll use that. And we have a supportive high chair that we set them in. So intervention wise, that hierarchy of exposure. So we use the SOS steps to eating for our hierarchy. I think I know the developmental food continuum by heart and the steps to eating. So could outline all of
Yeah.
those, but we incorporate, that food play. I feel like is one of the most important things that we can do. Just if they're not going to touch it, if it's on the table, they're not going to put it in their mouth, right? So there's so much of that, or they are, but they're not learning about the food while they're doing that. They're just doing it to get it down, right? They're not
Mhm.
really
Right.
experiencing that food. Messy exploration, routines to build tolerance and confidence. Might all include that coaching caregivers how to offer foods differently in a different way or create a more supportive mealtime rhythm at home. I said might include, it always includes for me. How do we incorporate these strategies into what you're doing at home as well?
Mhm. Yeah, and I think and we're not necessarily doing any kind of, advertising for SOS. That's just one of the tools, and like you said earlier, there's different programs, but we want the
Yes.
programs to include the what the research says works, right? The child-led, the messy exploration, and the play
Yeah.
pieces, the parent coaching. Um What else do we need to consider, though, when it comes to maybe the perspectives of some of the other folks who are involved? Whether it's the child or the middle schooler, other care providers that you're working with. Because earlier, I think you said something about it being multidisciplinary. So, are there any kind of points that we need to cover, or word choices, or strategies that help with, buy-in,
Yeah.
carryover?
So I think that a big thing, the language that we use really matters, right? So I often use phrases like a food explorer or we're learning about food instead of you need to eat this. And so I think that's a big one. I'll work sometimes with the teacher. I might send a letter, I might call, the child's teacher or their speech therapist or the parent or the grandparent, even sometimes, and kind of talk about just that we're using this language with them, right? I feel like especially that we're learning about food is a really big one versus like you need to eat this food. For caregivers, I frame that feeding as a journey, so it's not a sprint. I think that's so difficult, because it does take a lot of time, to really add these new foods. I mean, we could do a sprint, but they're not having a relationship with food in a positive way. And
Mhm.
there are times that is needed. If you have a kid who's just not making progress with this approach, and we're looking at a feeding tube, or never getting off of a feeding tube, there are times I think that intensive feeding models um, may be needed, but I feel like this approach, it is, that trauma informed, the child led, play based approach, but it does take longer. And I make sure that families understand that it can take, a little bit of time, and really just emphasizing that progress over perfection, validate their stress, and help reframe that picky eating as a skill building opportunity, not a behavior to fix. When I can collaborate with teachers, SLPs, dietitians, I emphasize shared goals. So, like improving participation, decreasing mealtime stress, and expanding food variety over time.
Yeah, those are great points. And I think it's a cool opportunity whenever we get to work with other um, professions that we can kind of throw in, like this is how we look at it, and this is the occupational piece of it, which is always kind of a great opportunity. So if we're really talking about maximum impact, and earlier I heard, with the cheeseburger story, um, that this kid expanded to like 75 foods. That's a pretty big success story right there. So talking maximum impact, if we're thinking about all what the research says, narrowing it down to your top 3 actionable takeaways for therapists to put into practice, what would they be? And we know you just said the language was really important, so I'm
Yeah,
not forgetting that
yeah,
piece either.
yeah. So I think my top three would be following the child's lead, coaching the caregiver, and then making sure that we're celebrating just those tiny wins. So when we look at following the child's lead, starting where they are comfortable. So I always start my session with a food that I know they're going to eat. So we're always starting somewhere comfortable, and using play as a bridge to progress. Uh, that 3-bite rule doesn't really work, right? Take 3 bites of this. So making sure that we're following their lead and we're not forcing them to eat. We're not, again, getting that adrenaline up and then we're done. Again, coaching caregivers is so important. So even just 5 or 10 minutes per session, or sending something home, like I talked about, like here's what they ate today. Here's what I would love for you to try at home. Here's this specific, because sometimes it is a very specific brand of something they ate, this very specific Kraft mac and cheese. Try this one at home. We're going to build on this, but this is one they ate here. And I have that often, like where they'll eat a lot of stuff with me at food therapy, but they're not going to eat them at home. And so I look at how are they being presented this food? What have they already ate at home? Are they completely full? Those kinds of things. Celebrating those tiny wins is so important. So just even a lick or a touch, any kind of thing, just sitting calm near a new food, I celebrate that. And we love the SOS, like there's a number, 1 to 10, and so we look at like how many points we can get, on that scale, but we celebrate 1 point, right? But the
Right.
kids, the older kids especially love that, and just reinforcing that. That exposure piece is so important. So many times for a kid to like something. I know we talked about, 10 and up to 70 for some kids.
Mhm.
We often, we just go with what we know our kids will eat. We don't offer a lot of new things. And I find that often, um, in my practices, they're really not being exposed to a lot of different or new foods. And then parents are often picky eaters as well, and so they're not exposing their kids to new food. So
Right.
I find that quite often. And so when I have parents who are picky eaters, they're eating with me at the table as well. So
Yeah. Oh, I love that. Earlier you were saying something about dad too, and I know we've been talking a lot about mom and mom
Yeah.
being involved, but I know you have dads involved as well.
Yes. Yep.
Yeah.
And,
You know, the
the
apple
dad
doesn't fall far
I'm
from
not
the tree,
I'm
right?
not dissing dads, but dads are usually the ones that are like, "Don't play with your food," we don't do that here, so I have a bit of work cut out for me with dads sometimes because 'cause they're the ones
Well, and
trying to get through.
yeah, and
Yeah.
you were talking about messy play earlier, and I can imagine there are some families where that's gonna cause stress
Yeah.
to the parents.
And you do have to be aware of that, cultural differences,
Mhm,
that can play a role in this as well. So, being mindful of those kinds of things
mhm,
is important, of
right.
course.
So, this is really good advice. Lead with the kid, let them have control and power, we love that. Empower the family as well, and celebrate the small wins, and I like how you were saying, just every little point, you can really go over the top with celebrating that. That's really great advice. So, what I would love to do now is take this through a case scenario, a success story, if you will. We talked a little bit earlier about the cheeseburger
Yeah.
story, but I'd like to hear, maybe a couple scenarios that you can share with us of how you've taken this all the way through with a young kid or a middle schooler and their family.
Yeah. So I had a 3-year-old only eats, beige crunchy foods. This is just one example. We started with food play with like dry pasta. We progressed to painting with yogurt on crackers. And this one didn't take very long. So 6 weeks, she was licking, soft foods at the table with the family. So that was something that hadn't happened for her, in over a year. She hadn't done that. And every kiddo's journey looks different, but those principles I think apply for everyone: that respect, pacing, that graded exposure over time. I have a little one that I work with that like only eats cheese. That's the only thing. So we've been working through cheese and every different kind of cheese for a long time. So now we're working on like anything else that's orange, jello, that we can get through. But she is adding, a lot of new things at home. But it is such a journey. It really is. It's definitely not a sprint. There's, so much to it. But, even I have a lot of kids that like their main focus is like, I have nothing that I can eat at school, right? And so we really look
Okay.
at how can we, you know, mimic what they're eating at school in the clinic. So I'll look at their school menu, or we'll look at what can they pack in their lunchbox. And is there proteins, fruits, vegetables, starches? So we look at some of those kinds of things as well. Um, I love my kid with the cheeseburger. That's one of my favorite stories, I think. But there's so many, I really can't like narrow it down. I
Well, do
feel
you
like
have
I
maybe you were talking earlier about the middle schooler. I wanna go back to maybe one of the middle schoolers, and how are you working with one of them? Do you ever involve, like, maybe, videotaping themselves videotaping, that makes me sound so old, recording themselves, and bring
Yeah,
it back to
so,
'80s.
like, food science is really good, or, like, we'll record sometimes, like, them making a YouTube video of a
Right.
new recipe that they made or that they wanna try, so really incorporating, they're all into social media, so, incorporating stuff like that into their sessions is really good. I'll even have, like, where their friends might come in, to some of their
Ah,
sessions with them, and so, having that peer modeling, or we'll do some sessions where like I have a kid with me and another therapist has a kid with them and we're doing sessions together. So I've done that before as well. But I had a lot of success with like my 6 week cohort program to coach parents. I've had a lot of success with that. And even really just getting them started. Like I had one family that was able to kind of they took it on themselves and they made like a menu for their kid. Like, here's everything that he eats, and here's some things that are similar to those things that he eats. And so they made this menu for him to choose from, or they, had him where he was picking a new restaurant that they would get to go to once a month. And they knew, like, okay, ahead of time, we're going to look at what the menu is and help him choose something that he can eat, but really just, empowering him and giving him those choices versus that, like, you need to eat something,
mhm,
that stressful mealtime. So really, that parent empowerment is huge.
right. Yeah, and I kind of get the feeling beige is popular, white foods not so much. They're
Yes.
probably on the hit list, right?
Yeah.
The ranch dressings,
Yes,
the
yes, yes.
mayonnaise,
Yep,
the
yep, for
white
sure.
cheese.
Yes, yeah,
Right.
and, I see that a lot. It's like when I'm doing their food list, I'm like, "Do you realize that your child's only eating, beige foods? We're eating nothing green. There's no green in here," and so how do we get there? If we can eat a beige veggie straw, then can we add maybe an orange one or a green one? And then if they can eat an orange veggie straw, can we move to a carrot stick, that's the same shape? So it's really a lot of like food chaining and them being comfortable, eating something that's similar. Their brain says this is safe. Like this is safe. I can
Mhm.
eat this now. This is similar in shape, texture, color, size, whatever way that it's similar. And okay, I might be able to do this one, right? But allowing them to decide what they're going to do with that food. Like it's our job to expose them to it in some way, but it's up to them to decide what they're going to do with it. And sometimes that might even look like I'm just going to put it in the trash can, right? Like I'm getting that out of my space and it's going in the trash and that's okay. That's an exposure. So
That's an exposure, that's right, and if you're going toward 10, that one
yeah,
counts. Yeah,
yes,
and I think, what I'm really hearing the takeaway here to reemphasize because so much of this is emotional. So much of this is stress and anxiety and shame. I can't emphasize that enough. But I really hear you saying that there is this culture of respect, this culture of empowerment, this culture of pacing, safety, safety in so many ways, right? Not only just the breathing and the swallowing, but safety in this food is safe for me to eat. Um, and everything's done at a pace that is, you know, okay with the kid so that we're not increasing that stress level for the
yes,
family.
yes,
And I just think that's coming through in spades right now because I'm just hearing that theme. And I think anyone who's listening to this that says, I want to start really helping these kids and the families, that's really a huge takeaway in all of this.
for sure. Yeah.
Yeah. And
Yeah,
helping the parents.
yes. I think the parent piece is so huge and really helping the parent look through a different lens, right? I think is so important. Helping them be able to do that.
Yeah. And like you said, that's a big piece of this is changing, the perspective too, because so much of this was punitive.
Yeah.
Yeah. I know that's kind of what I grew up with.
Yes.
Yeah, so it's a big shift because I
Yeah.
can remember when I was a kid being forced to eat things like at school,
Yeah.
um, which is wild to me that was sort of how we did things, but that's how we
Yes.
did things. So being patient, we have to unlearn some things.
Yes.
So on that note, to wrap things up, what would be your final words of wisdom or inspiration that you would like to, kind of leave the audience?
Yeah. So I think, feeding isn't just about food. It's about that connection, trust, regulation. Progress doesn't always look like bites swallowed. It can be eye contact with a new food, or a parent feeling less anxious at mealtime. Keep showing up, stay curious, remember that every step matters and you're making more of a difference than you realize.
That's a great point. Well, on that note, that's all that we have time for today. I want to thank Liz Legg again for her insight and her therapy takeaways related to sensory based pediatric feeding. Thank you, Liz.
Thank you, Nicole.
Thank you for tuning into this episode of Pediatric Pioneers by MedBridge. Please be sure to subscribe and listen to more of our episodes on Spotify or on your favorite podcast platform and at medbridge.com. If you're listening outside of the MedBridge catalog and would like to access the bonus resources and receive continuing education credit, simply log into your MedBridge account and complete the quiz for this episode. Pediatric Pioneers also listens to you. If there is a particular practitioner that you'd like to hear from, or if you have a question or challenge that you'd like to explore on this podcast, please let us know by leaving a comment on our Instagram post or by emailing podcast@medbridge.com.